Today we have 1,510 cases. That's actually down 2 from yesterday. Again, a lot of times within the Michigan disease surveillance system, we have glitches and errors with regards to coding and where people live and things like that, that sometimes change numbers a little bit. So this is down 2 from what we reported yesterday. 31 deaths. We had an additional death on Saturday that was reported to us. Individual was in their early 90s, was male, and had some underlying health conditions. We have currently 4 people hospitalized. 2 of those are in ICU, and 319 people that are basically currently actively infected, but at home outpatient. So that leaves us with 1,156 recovered and a calculated case fatality rate of 2.1%. The monitoring, as you can see, there's a whole lot of monitoring activity going on, and that really has to do with monitoring folks who have been exposed or back in the days when we were doing more travel related quarantine, have been quarantined and are being actively monitored for quarantine, most of those these days due to known exposure. So this is our chart of our hospitalizations. We've been tracking nice and low. We're now at 4, which 5 was the highest we've been since looks like May 6th or 7th. So hoping to keep that number down. Our efforts have been going well related to that. So if we look at the breakdown of all the numbers, we have 76.6 recovered, 2.1% deceased, 21.1% actively infected but at home, and then 0.1% of our cases each in the hospital or in ICU. So our cumulative case curve looks like this. Again, we had flattened back in this early to mid-June time frame and then started back up. So we're waiting for a nice flattening again, which is starting to happen. Hopefully it continues. So this is our incidence curve. These are cases per day based on the onset of symptoms, or for example, if the person was asymptomatic, it would be from the date of referral or the date that the specimen was collected. So you see this big spike that we saw starting in mid-June, kind of gradually making its way down. And as you can see, that spike has taken us quite a while. We're now 2 months into basically pushing our numbers back down since that spike in early June, starting to now get close to these numbers we saw before we saw that huge spike in cases in mid-June. If you look at our percent positives per day, that is remaining fairly steady. So we are in really a fairly good range with our percent positives. I think we're under 2% right now. The last time I looked at the state My Start Map information, which is a good place to get that current number. But if we put those numbers, both of those numbers, into rolling averages, again, you'll see that this spike that we saw in mid-June has been really a longer haul than we had initially anticipated in terms of getting those numbers down. At one point in time, we thought we were going to continue to go down from here, but as you see, we came back up and now we're pressing down again. And that percent positivity number has been hanging at 3% or below. And like I said, the last number I saw was 1.9%. Back in here, we were below 0.5% here for a while. So by zip code, still 48911, followed by 48823, 48910, 48864, then 48906 and 912 in the 91 to 100, and then 48842 and 48854, 81 to 90, and things start dropping off from there. If we look at that just by cases on a map, we see the Lansing 48911 with the darkest shading, followed by 48823 in East Lansing, and then we start to group together a few others, although 48910, I believe, is by itself here as well. If we look at those by rate, basically adjusting for the differences in population in each of those zip codes, we see 48911 as our highest rate area as well, followed by East Lansing in the next rate category. And I think there's something right in here next to East Lansing. Somebody'd have to tell me what that, zip code is. It's not 48910 because that's this one. So we have some darker shading in here as well. So sorry for me not knowing my Lansing zip codes after almost 7 years any better than that. If we look at our heat map, that continues to stay, relatively the same with regards to the distribution of cases within the county, and is reflective of those case counts that we're showing you, where 48911 and 48823 are kind of our highest areas. We do have a hot spot here in, I believe this is 4891, it's either 912 or 915. So just a zoomed in version of that. So we see a couple of more dense hot spots in East Lansing. I'm going to guess one of these is probably Bircham Hills, where we've been dealing with some outbreaks. Nothing that has gotten horrible, but definitely, long-term care facility outbreaks have been some of the things we've been dealing with. Bircham Hills included, and the previous map would have shown you Ingham Medical. The breakdown by sex is 51% male, 49% female. And then by age group, we're still in that 20 to 29 age group being our highest prevalence age group in terms of percent in that age group, more than double any of our other age groups. We also look at by race, 54% Caucasian, 24% African American, 9% Asian, 10% other, 3% unknown. Again, important to look at that by rate, where the rate for Caucasians is 376 per 100,000 and African Americans is 1,105. That's 2.9 times higher, so almost 3 times higher, whereas the Asian rate is 746. That's about double our Caucasian rate. If we look by ethnicity, it is 81.4% non-Hispanic or Latino and 10% Hispanic or Latino, 8.6% unknown. And that is about, for our Hispanic and Latino population, they're close to 1.5 times the not Hispanic or Latino population in terms of rate. We did have an additional death, so I'll give you this breakdown of deaths by statistics. So by age, 45.2% are over the age of 80. 25.8% are 70 to 79, 16.1% 60 to 69, and 12.9% 50 to 59. We have not had a death in Ingham County under the age of 50. By sex, it is 51.6% male, 48.4% female. By race, we are 64.5% Caucasian and 32.3% African American and 3.2% other. And then by ethnicity, 87.1% non-Hispanic or Latino and 6.5% Hispanic or Latino, 6.5% unknown. So I believe I just pulled down some graphs that are going to show up next, and we're going to talk about one. Sorry for the poor quality of graphs. I pulled them off of a spreadsheet on the state's website, and at the end I'll tell you why these are so poor quality. So these are cases by age group trending across the state. So they do give us some age groups. So you can kind of see the bars here. They disappeared a little bit on me. So this is our 80 plus age group and the trending in cases as well as rate. There's a percent change in the legend there. I deleted the percent change bar because it's really a mess. And I'll show you that at the end. If we look at percent, these just did not come out well at all. What I saw was very different from this. So I am sorry about that. 70 to 79, but again, what you see is we had higher numbers in this age group at the end, and we have lower numbers now. Same with the 60 to 69 age group. Hopefully this is going to be telling in just a minute. 50 to 59, 40 to 49, 30 to 39. And then if we look at, yeah, these just did not turn out so well. So what you see here in our 20 to 29 age group, and I'll do some work to get these clear, but you can see some like blank spaces in here. we had this spike that we know of that happened in early to mid-June, which happened here in Ingham County as well. Very hard to see. I don't know why it came across that way when I plunked it into a PowerPoint, but you can see this shift in age ranges. And then the next shift that you see is if we start looking at our 0 to 19 age group, where you're seeing these case rates come up here compared to where they were earlier in this whole epidemic or pandemic. And the same thing is happening here with the cases. It's just for some reason it's shadowed out instead of colored in. I show you that because I think I read, I forget what state it was. Oh, here's what the graphs look like until I took the red bar out of there. So I took the red line out of there, which messed up the rest of it. Next time I'll just show it to you and you can ignore the percent change line. I thought it was messy and ugly, so I tried to pull them out of there and it messed up the entire graph. So you have my apologies for that. I will get you those graphs. Amanda, we can just send them these graphs afterwards so that they can see what we were talking about.
Yes.
Because basically what it does is it aligns with what we're hearing and seeing in national trends, which I forget what state it was that basically shared information that I believe maybe 70% of their cases in the last week or two were all in children, so under the age of 20. So I was looking at those statistics for our different age groups to see where we as a state and where we as a county were also headed with that kind of demographic shift in age groups. We've seen that very clear with the percent of 20 to 29-year-olds that have been increasing and increasing on us. We haven't really been talking about the other age groups. And we also haven't looked at age group by rate, which once again adjusts for the population or the number of people in any given age group and is a little bit more telling as to where we're headed with that. So we too in the state of Michigan are seeing that upward tick in cases in children compared to what we were seeing early in March where we had relatively few cases in children. So I apologize for all those graphs. They looked beautiful when I had them on my screen. They don't look beautiful when I shared it with you. I will send you each of those that I just showed you. They come from a spreadsheet that the state makes available to us online in an email so that you can actually see what those look like. We'll just leave in that bouncing around red bar that I was trying to get away from you because I thought it was distracting and it ruined it all. So we'll do better next time. Thank you.
Thank you, Linda. Does anyone have any questions for Health Officer Linda Vail?
Oh, my graphs were so ugly, you don't even like me anymore.
Craig Lyons, go ahead.
Yeah, Linda, I know last week you had briefly mentioned the potential for a pilot program with MSU for contact tracing. I was curious if you could give any updates on where that stands and what that might look like if it moves forward.
I sure can. It actually is, it's helpful to contact tracing. What it is it's an exposure notification system. So you probably saw it pushed out on your phone where you can turn on this, COVID tracking thing. Well, I can turn it on my phone, but it has to be paired to an app that actually allows it to work. So when I go to turn on my phone, turn on COVID tracking on my iPhone, which I have, the same with Androids, it will tell me that I need to have an app that is associated with it. So Google has been in development of that app. It is now resolving the issue that there was an app that would work on Android devices but did not work on Apple devices. So this is one that will work on both devices. And it also eliminated some of the privacy concerns that were originally in some of the early app conversations and discussions in terms of exposure notification. So what it does, if I turn it on and other people around me turn it on, and campus is a great place to do it because it's dense and we have a lot of kids coming in it. And, one of the things that, the Apple folks told us, and I'm going to call it ageism, but I'm in that age group, younger people may perhaps be more likely to take advantage of a lot of this app-based technology. So they were looking for a university to pilot it at. So the university is interested. We are moving forward with additional conversations. But basically what it would do is, so I have it turned on my phone, you have it turned on your phone. If we are within proximity to each other for a long enough period of time, it's not going to pick up those. Remember, risk is close together for like 15 minutes. So it's going to pick up those encounters where people are relatively close together for a bit longer time, and it's going to to kind of save those within your device. Your device will know. So then if you as an individual get a notification that you have tested positive, you may now also, and that's part of the privacy part of it, push that information out after getting a key from the health department. So that keeps people who just, would want to play strange games, like just pushing out information that they tested positive, but they didn't, from doing things like that. So they get a key from the health department, they push out that notification, then anybody whose phone was also activated to do that has contact with them that would be at risk would then be notified that they have been exposed and to contact the health department. So it kind of works like that.
Go ahead, Kate Wells.
Yeah. Hey, Linda. My question is actually fairly specific, but also sort of following up on what you spoke to a lot in this presentation, sort of around the age range. I know last week and in previous weeks, we've been talking about some of the difficulty that Ingham County and other counties were having with contact tracing with teens and early 20-somethings. You talked about using MSU and other ways that people were trying to go about doing this. I'm wondering if there's been any sort of further discussion on that, and if that continues to be the experience, that one, it is a challenge. And two, I'm hearing from some health officials that they're trying to look at texting as an option with this age group. I wonder if you can speak to that.
Well, first of all, we already do texting. The state with their Trace Force is pushing out some additional texting platforms. We do try not to contact somebody by text during an initial contact for various and sundry, privacy reasons, to make sure that we're getting a hold of the right person, that sort of thing. So our initial contact tends to be by phone if we can make that happen. Obviously, in the interests of, getting the most effective means of getting a hold of people possible, we may have to reconsider that and allow a text message that says, you need to call the health department over an important matter. That's probably all it would say. And then if we ended up having somebody call us and it was the wrong person, we'd go, oh, sorry, wrong number, which is going to be embarrassing. So that's why we try to do it by phone contact first, just in case that is one of those things where, you can transpose a phone number when you're filling out a form, and before you know it, you actually are speaking to somebody else. So texting is definitely something that we use, something that we will continue to consider to use more robustly, and the state is putting out platforms for that. As far as the actual contact tracing stuff, it does still become a challenge at times, but we also have the authority to require people to cooperate with us, and when it comes to that, that's what we're doing. We're issuing letters, basically warning letters requiring cooperation with the health department if that's what it takes. Usually by the time you're telling somebody that you're going to issue a warning letter, or you issue a warning letter that essentially says that they can go to court over it, then people will pretty much cooperate. So we don't like to have to do those measures, but it is important. So.
And just so I understand, if the initial contact is not being done via text, how is can you give me an example of typically how texting is being used by Ingham County when it comes to tracing and contact tracing?
Oh, so once you have an initial contact with somebody, then you also have to continue to check in on them. You have to help them make sure that they're, like, if somebody's at home in isolation, are they getting food and things like that? We'll check on those things. And also there are, when do we release somebody from isolation? It's like, okay, your symptoms are resolved. It's been 24 hours. Those kind of conversations can happen via text. In addition, the monitoring, like I mentioned, which is folks who are quarantined. So those people too, we will check up on a fairly regular basis, and we can do all of that via text.
Gotcha. Thanks, Linda.
Mm-hmm.
Go ahead, Megan.
If I remember correctly, last week you said the health department was working on getting it to show Ingham County Health Department in caller ID. Has there been any progress on that?
Oh, that was actually several weeks ago now. And yes, there has. So the outgoing message now says Ingham County Health Department. Here is the dilemma that we faced. Verizon can do it one of two ways. It can be an unknown call, or it can have a name and a number associated with it. There's no way to disassociate the name with the number. So when our staff call, it says the Ingham County Health Department and then also discloses their phone number. So they all have work phone numbers, but they all are also, somewhat concerned about, their numbers being out there and people just being able to call them and all those sorts of things. So we just move forward with that. That's what we have. We have considered looking at other types of technology that might help with that, but we haven't moved forward from that right now. So there is an outgoing caller ID that says Ingham County Health Department. Unfortunately for our staff, it also identifies their phone number. So it is not an unknown number when they call out.
Okay.
Does anyone else have a question for Linda Vail?
I do, if that's all right.
Go ahead.
Hi, Linda. I'm just asking about the Big Ten announcement, just kind of like your first reactions, first thoughts about, football, how it's being canceled this year, kind of what's going through your mind about that.
Well, first of all, you have to know that I'm a huge college football fan. It is like my favorite thing to watch on TV. So I went years, didn't watch any TV at all except for college football. So I'm deeply saddened. However, all that aside, it's very difficult to imagine us basically having to go through all kinds of precautions and testing and online classes and cohorting and getting all of that stuff for education, and then just saying, but we can do football. So I can completely understand. And honestly, we've had, it's close contact. People are in huddles for, periods of time right up in each other's faces, still breathing hard from the last play and all of those sorts of things. So it is without a doubt not the best environment for prevention, and is also not a very suitable environment for a lot of the protective measures that would allow it to continue. So mask wearing, obviously distancing, those sorts of things, it's just going to be a challenge. And with as many cases as we've seen, just related to athletes coming back and going back to training, that doesn't bode well for what would happen during the season. The only thing we have going for us, as continues to be said, and I think I was watching CNN last night about this, is that young people do seem to not become as ill in general, or are more likely to be symptomatic. That doesn't mean that they can't become severely ill, and we have got to be attentive to that and protective of our young people related to that. I would say that, the same goes for, I know that Lansing School District has canceled all of their fall athletics, and I don't know whether other districts are going to do the same. I think it's especially hard to argue in a school district that is not a college school district, where they're not making, big money from football, which I know they do in college, that you can't go back to school for face-to-face learning, but we can play football. I think that's a really hard sell. And so I think that the degree to which we are concerned that we can't go back to face-to-face learning, and remembering that going to school, going to high school, and going to college is primarily about education, that we have to be very careful that if we are concerned about being able to go back to face-to-face learning and accomplish that primary objective of learning or education in our educational systems, then we need to be equally concerned or more concerned about athletics.
Okay, thank you. And then another topic people have been talking about is wearing masks outdoors. I know that East Lansing has started Monday wearing masks outdoors downtown. Do you think that this is the right step in the direction to prevent the spread?
Well, I mean, you know, crowded cities are a good place for that to be the case. So, I'm not the East Lansing City Council, and I can't give you a pulse on how crowded the streets of East Lansing are on a daily basis with people walking by. If I was in New York City or something like that, I would say that's a perfect example of, yes, masks outdoors. Technically, if you are not within 6 feet of somebody outdoors, or are less, or I should say more than 6 feet away from somebody outdoors, but there's something like singing or shouting or exercise going on, then there's not really a need for a mask. If you are closer than that to people and are staying near people for any period of time outside, then masks are important outside as well.